ओम धम धन्वंतरे नमः। रागादिरोगान् सतान शक्तान् अशेषकायान् प्रस्थान शेषान् औत्सुक्य मोहान् रतिदान् जघान यो पूर्ववैद्याय नमोस्तु तस्मै। Let me share. So today's topic is osteoarthritis, the X-ray study. We have here in this video we have discussed the osteoarthritis stages in the X-ray, in osteoarthritis of the knee joint, osteoarthritis of the vertebral column, and osteoarthritis of the ankle joint. So osteoarthritis is a degenerative joint disease which is usually caused in old age, isn't it? In osteoarthritis of the knee joint, X-ray study findings are: number 1, unequal reduction in joint space; number 2, sclerosis of interarticular borders; number 3, osteophytosis, that is subchondral sclerosis, and non-uniform joint space narrowing. So here you can see the arrow mark shows decreased joint space in both the X-rays. The AP view, the decreased joint space is noted. Here you see on the right side, there are 3 arrow marks are there, isn't it? They're showing decreased joint space and subchondral sclerosis, isn't it? Osteophytes formation. So here also the X-ray of the knee joint, you can see decreased joint space, isn't it? Unequal decreased joint space and subchondral sclerosis. Here lateral view, it shows decreased unequal reduced joint space and subchondral sclerosis. Okay. Here you see the right side, there is a subchondral sclerosis is seen, isn't it? Here also again on the right side there is a subchondral sclerosis and decreased joint space. Now coming to spinal osteoarthritis, in that joint space narrowing, osteophytes, subchondral cysts or sclerosis, these 3 are same. So in spinal arthritis, osteoarthritis, joint space narrowing, osteophytosis, and subchondral cysts and sclerosis, these are same. Now let us see the stages of osteophytes. There are 2 stages. Number 1, spondylosis deformans. Number 2, intervertebral osteochondrosis. In spondylosis deformans, bony spurs arising from the anterior and lateral end plate apophytes, which project obliquely or horizontally. In second stage, intervertebral osteochondrosis, disc space narrowing, vacuum phenomenon, end plate cartilage erosions, and vertebral body reactive changes, that is osteophytes and modic changes. So in stages of osteophytes, 2 stages are there: spondylosis deformans and intervertebral osteochondrosis. So these are X-ray of the cervical spine, lateral view, isn't it? You can see reduced joint space, subchondral sclerosis, loss of curvature, these are same, isn't it? On osteophytosis. Another X-ray of the cervical spine, you can see reduced joint space, subchondral sclerosis, and osteophytes formation, and loss of curvature, cervical curvature. Here you see the lateral X-ray of the cervical spine. You can see narrowing of the joint space and the bony spurs are formed. The arrow mark show, isn't it? Here the X-ray of the cervical spine lateral view. You can see reduced joint space, osteophytosis, and subchondral sclerosis. This is the lumbar spine. Lumbar spine, you can see the osteophytes. The arrow mark shows osteophytosis. You see lumbar spine, you see loss of curvature is there, and reduced joint space and osteophytosis. These are very clear. Here you see the L4 and L5. You can see there osteophytes are there, and subchondral sclerosis is there. Here again an X-ray of lumbar spine. You can see reduced joint space and subchondral sclerosis. Now coming to osteoarthritis of the knee joint, there are 5 findings. osteophyte formation, joint space narrowing, subchondral sclerosis, subchondral cyst formation, and remodeling of the articular surface or deformity in more advanced stages. Now, all the five may not be seen in a patient, isn't it? Depending upon the degree of damage, there will be findings, isn't it? Again, osteoarthritis of the knee joint, five findings are seen usually: osteophyte formation, joint space narrowing, subchondral sclerosis, subchondral cyst formation, and remodeling of the articular surface or deformity in more advanced stages. So, radiograph features are like other joints of osteoarthritis. The ankle is characterized by osteophyte formation, joint space narrowing, subchondral sclerosis, and subchondral cyst formation, and remodeling of the articular surfaces. And plain radiograph, it is evident that weight bearing anteroposterior and lateral views of the ankle and mortise views are done for the assessment of osteoarthritis. The salesman view can be acquired for the evaluation of hind foot alignment. The medial, superior tibio-talar space and tibio-fibular joint space are evaluated. So, the Kellergin and Lawrence score has been modified for the ankle joint. Grade 1, there are 4 grades: grade 1, grade 2, grade 3, and grade 4. In grade 1, osteophytes of questionable significance on the medial and lateral malleolus, rare tibial sclerosis, no joint space narrowing. In grade 2, osteophytes on the medial malleolus, no joint space narrowing. Grade 3, osteophytes on the medial and lateral malleolus, moderate joint space narrowing, that is less than 50%. Grade 3A, talar tilt is less than 2 degrees. Grade 3B, talar tilt more than 2 degrees. In grade 4, osteophytes on medial and lateral malleolus as well as tibio-talar joint margins, severe, that is more than 50%. Joint space narrowing, constant tibio-talar sclerosis. It is considered reliable and has been shown to correlate with the clinical symptoms. We have to correlate with the clinical symptoms. So it is considered reliable and has been shown to correlate with the clinical symptoms. Kellergin and Lawrence grade more than or equal to 1 is consistent with the ankle osteoarthritis. A grading of different features of osteoarthritis can be also achieved by using the OARCI atlas. So you can see the ankle joint, the tibio-talar joint. There is a reduced joint space and subchondral sclerosis. And alignment is also slightly altered. There is another X-ray of the knee joint. You can see talus and the calcaneum. The joint space is reduced and subchondral sclerosis is seen. Here you see the ankle joint and subtalar joint. There are reduced joint space and subchondral sclerosis. Here another X-ray which shows subtalar joint, reduced joint space and subchondral sclerosis. This again, the arrow mark shows the subtalar joint with the reduced joint space and subchondral sclerosis. So today we have discussed osteoarthritic changes in the X-rays of knee joint and vertebral column and also spinal column and also the ankle joint. Thank you for patient hearing.